East London NHS Foundation Trust has set itself a mission to provide the highest quality mental health and community care in England. To help us to achieve this, we developed the Quality Improvement Programme, the QI programme, which was launched in February 2014.
Our QI programme is designed to change the very culture of this organisation, to shift power and decision making to frontline teams, and to help teams and service users and carers to work together to tackle complex issues, unleashing their power and creativity. To help focus our work in the early years, we set ourselves two high-level stretch aims: to reduce harm by 30% every year and to ensure that every patient receives the right care at the right place at the right time. To date, the QI programme has focused on building the will and motivation within the organisation, enhancing people's knowledge and skills, on supporting teams working on projects associated with the two high-level stretch aims, and on ensuring that QI work is aligned and embedded with business as usual.
Because the Trust wants to understand the impact of the QI programme over the first 12 to 18 months and to learn about the factors that are helping and hindering our approach. This will help us continue to adapt the way we deliver the programme going forward.
Over a 3-month period, we used existing data, interviewed service users, staff and the board, and surveyed both people who had experience of QI and people who hadn't taken part in QI, so that we could understand better how the programme is being delivered, as well as what lessons can be learned so far. We looked at the following things: whether there is increased will to implement QI, whether staff have increased knowledge and skills relating to QI, the extent to which clinical and operational systems are aligned to the QI approach, whether there has been a reduction in harm, whether QI approaches are helping to deliver the right care at the right time and the right place, and what is helping and hindering the implementation of QI.
The evaluation found that the Trust has undertaken a large and multifaceted communication campaign to build awareness around the Quality Improvement Programme. The team found that communications are welcomed, but there remains scope for wider reach and accessibility of information.
How has the Trust built improvement capability?
The Trust has built support systems to enable QI work to flourish. There are more than 160 projects running throughout the Trust. Teams now have access to local support systems that includes QI sponsors, coaches, and forums that are attended by QI leads and people participation leads. However, there is more to be done to increase service user and carer involvement in QI, to address the time and resources required to undertake QI work, and help teams understand how other improvement methodologies sit alongside QI.
So our programme aim is to reduce harm by 30% every year. How are we doing on this?
You also aim to provide the right care at the right place at the right time. How's that going?
The evaluation found that a number of factors supported the implementation of the QI programme. Common helpful factors included engagement of frontline teams, support from QI team, and strong leadership. The three most commonly identified barriers were unclear expectations regarding the QI programme, the lack of support and structures, and communication issues. QI training was identified as both a helping and a hindering factor. Training was perceived to help by offering a formal yet creative programme to spark ideas and support change. On the other hand, issues with a perceived lack of accessibility and lack of flexibility of existing training options were noted.
Are there any lessons you'd like to share from the QI evaluation?
Drawing all of the evaluation information together, there are some key lessons that we learnt. We learnt that a well-functioning support structure to enable QI work is critical. The projects that are surrounded by well-functioning support systems have found it easier to make some progress. We learnt that training has had a positive impact on those who attended, as well as the volume and progress of the projects. However, there is room to develop more accessible training programs. Time and resources are also a critical issue for those attempting QI approaches. Where clinical leaders were not only involved but also lead in projects, they were more often able to create structures and space to incorporate QI into day-to-day work. There is more work to be done to consider how QI can be further integrated into business as usual within the Trust. We also learnt that the QI programme is using numerous communication channels and there is scope to extend this further. And we learnt that service user involvement in QI work could be strengthened. It's positive that almost a third of projects have service user input, but there is much to be done to increase this figure further.
We have discussed these key learning points as an executive team, with the Trust Board and with our clinical and service directors, and over the coming weeks we'll be working on a few key points. Firstly, we want to strengthen the support structure around QI projects with clear structures in each directorate to support this work. The QI coaches that have recently come into post will also provide an additional level of support for teams in this area. Also, each directorate management team will be looking to see if there are things that we can do differently or stop doing in order to give more space and time for QI work. We will be communicating more about the outcomes from QI projects so people can start seeing the impact that these approaches have had. Finally, we will be testing and evaluating a number of ways to engage service users and carers more in QI projects. Overall, staff and service users of the Trust can be proud of all of the work that has been done and successes that have been achieved. And we will use these findings to continue to strengthen the programme for the benefit of service users and staff.